You're watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, body contouring or liposuction, what you need to know. With us, we have an expert on the topic. He's board certified in plastic and reconstructive surgery. With us, we have Dr. Nichter. Dr. Nichter, welcome to the program.
Thanks, Randy.
Now, for people that don't know you or know your practice, who's your typical patient? What are the different procedures that you do? Before we get into the liposuction.
Typical patients are women from ages of 16 to 85 or even older, but typically they want to improve their overall appearance. We do a tremendous amount of body contouring, mostly liposuction is what I mean by that term.
Okay. Now you call it body contouring. Tell me about that.
The reason I call it body contouring because it involves all areas of the body.
Okay.
It could be improving the neck area, which typically is done with liposuction, but could also use lifting techniques. It could be doing breast reduction using some liposuction techniques, but we also can add some fat to the upper part of the breast that may be missing it. Or we may take it from the tummy and put it to the buttocks, for example, what's typically called, quotes, Brazilian butt lift. So it's not just taking away the fat, which is liposuction, but also potentially using the fat to, to the patient's benefit.
With liposuction, so what's the most popular area?
Clearly, it's love handles, saddlebags, lower and upper tummy in particular, and lower back. And that really is what brings in the waistline.
Now, is there a lot of technique to this, or does the machine do all the work?
Boy, wouldn't that be great? No, it's all technique specific, and you really want to go to someone who's done hundreds to thousands of these procedures in the course of their time to get the best results. It's very technique specific to get it very even and very smooth and get the results you want.
Who's coming in for the liposuction? Mostly for the abs and love handles.
Yeah, so I'm going to give you an example. This is my receptionist. My receptionist has been with me for many years, and she sees all these patients come in, and she's had her kids. She gained some weight afterwards. She doesn't want to go to a health club because she doesn't think she can fit into the health exercise outfits. She doesn't go out to the beach and stuff like that. And she finally said, do you think I would be a great candidate? This is my own receptionist. Mm-hmm. Once she had liposuction and a tummy tuck as well, her whole life changed. She was outgoing. She went to boot camp. She's running a half marathon this next weekend.
Interesting.
Incredible change. It literally transformed someone. It's very exciting.
So who's an ideal candidate for liposuction?
An ideal candidate is someone at, number one, steady weight. Two is they have some elasticity of their skin that's left, which is most of our patients that are there. And they have disproportionate fat. Like there's one area that just bugs me. It's my love handles, or it's my saddlebags area, and maybe a couple other areas. It's obviously not a substitute for diet and exercise, but boy, patients just love it.
They do. Now what about the bra strap area? I think you told me on the phone.
Yeah.
Can you do that area?
Yes, we spoke about that. So
like on the back, the fat on the upper back.
Both just the back rolls in the back, but also even on the sides. Women hate that because the bra strap just goes around and it sort of hangs over. It turns out the skin's relatively thicker in those areas, which is a good thing. It means that the skin retracts and snaps back to normal a lot better after liposuction. Great areas to do.
Arms? What about arms?
Arms are great. Now arms, the skin's a lot thinner, so you get rid of a lot of the weight which causes the skin to hang down, and that improves things tremendously. And then we also have techniques after that if there's any skin that's not as tight as you'd like. The Cyton skin tight laser we have, for example, which will tighten that skin afterwards to give you a nice smooth appearance.
Okay. Now, what about thighs and hips and saddlebags in that area?
Great areas to do. So again, whether you're in or out of clothes, liposuction techniques work great. So if it's the saddlebags area, you may have a woman who's always she's had those skinny jeans she used to wear when she was in high school or college or when she was much younger and hasn't gotten into them in 10 years. And it's just because of that one area. Do that and they get back in those jeans and they're, on top of the world.
Okay. What's changed? Okay. And how long have you been doing lipo, by the way? Liposuction, body contouring.
It feels like I just started, but 27 to 30 years.
27
now.
or 30 years, yeah. Okay. And so are you getting better results now, like much better results now than you did 10 years ago? And if so, why?
There's a lot of great improved techniques. One is that we use is this power-assisted liposuction. It shouldn't. For those of you that have looked at YouTube or something like that, it looks like it's a sport or something. It can be scary. In reality, with some of these newer devices, it's like playing a violin. And to get the best results, it's the non-dominant hand that guides where the liposuction wand goes that makes all the difference and guides it. And because you don't need a lot of effort to do the procedure, you can really concentrate on the finesse and the perfect result.
Okay, what about downtime? I mean, if somebody goes in on a Friday, could they be back to work on a Monday?
They can. So liposuction is one of those procedures where we encourage people to get back as soon as possible. The incisions, are tiny. They're little tiny things that are hidden, like in the belly button or pubic hairline. That's a great thing. We like them to use an elastic garment that can be hidden underneath any of their clothes, and we want them up and going right after surgery, the day of surgery, walking quite a bit. So when they feel up to it, and that could certainly be on a Monday, absolutely.
So what are the age ranges of the patients? Are they getting younger and younger or older and older for the procedure?
Both are right, as it turns out. So for example, on the younger age, there may be a woman in her 20s and her mom and her grandmother always have that little sagging, a little bit of fat underneath her chin. Mm-hmm. That's simple to take care of at a younger age. When as they get older, there could be hormonal related fat that just collects on the hip area or saddlebags, and that's easy to take care of also. So as long as you're healthy, and I'm talking about physically healthy, not chronologically. It's not the chronological age, but it's how youthful you are in terms of health.
What should somebody look for? And final question, we're out of time. What should somebody look for in a physician that's going to be doing liposuction?
They've done thousands in their career, that they're board certified by the American Board of Plastic Surgery, and that you have a chance to interview them and feel good about who you're entrusting your care and your beauty and your life to, and also get a chance to see their before and after pictures.
Okay, good. I want to thank you for coming on the show. Very interesting.
Pleasure.
If somebody wants to find out more, they can go to your website, look at before and after photos.
Absolutely.
Things like that.
Everything's available, including more information.
All right, great. Thanks. You've been watching The Wellness Hour. I'm Randy Alvarez. We will be right back.